For the 71 million Americans that have high cholesterol, there are ways of managing their numbers through diet and exercise. But imagine being diagnosed with a genetic disorder that causes soaring levels of plaque-building cholesterol, often since birth, that if left undiagnosed and untreated can cause aggressive premature heart disease or stroke. Coming up, what you need to know about a dangerous inheritance known as familial hypercholesterolemia, or FH. I'm Erica Vetrini in New York. Access Health starts now. We all know that an unhealthy lifestyle can lead to high cholesterol, and that too much cholesterol in your blood can lead to heart disease or stroke, which if left untreated can have devastating consequences. For the 1 in 250 individuals affected by the most common form of FH, early diagnosis and treatment of often soaring levels of cholesterol can lead to better outcomes. But for those with the rarer form of FH, called homozygous FH or HoFH, that causes extreme levels of cholesterol, often since before birth, the promise of life-threatening consequences rings all too true, sometimes loudly and often without warning.
FH is life-threatening. Exposure over a lifetime to those very high cholesterol levels can lead to early and aggressive heart disease, heart attacks, and early death.
Anywhere between 1 to 10% of these patients are being diagnosed right now in the United States. So that means 90% are probably not being told that they have a potential life-threatening condition that can be treated.
I went to the doctor for a routine checkup, and I had a heart attack in the doctor's office. So I was the first code blue at that hospital when I was 35 years old.
FH, otherwise known as familial hypercholesterolemia, is an inherited or genetic disorder that results in an abnormality in the way we clear cholesterol from the bloodstream. Oftentimes we make more of it than we should. Sometimes we even absorb more of it than we should. But the end result is this lifetime accumulation of high cholesterol. This process begins from birth. So one of the major issues of this condition is that people have high cholesterol from day one. And so they have the ability to accumulate cholesterol deposition in their artery walls from a very early age. So it's not just that they have high cholesterol, but that their blood vessels are exposed to high cholesterol over the course of their lifetime. And what this does is it increases the risk of cholesterol getting into the artery wall and starting the process of what we call atherosclerosis or heart disease.
Heart disease has always been a part of my life. I don't remember life without heart disease in it. My father, who has FH, he had his first heart attack when he was 28 years old. So some of my very earliest memories in life are of being at the hospital. We always knew that that was very, very prevalent on my father's side of the family. And he had 6 uncles and aunts. 4 of them had had heart attacks early in life. So it was always something that we knew about.
The way someone inherits this is from the mother or the father or both. The different types of familial hypercholesterolemia, one can either inherit 1 abnormality or 2 abnormalities. And this can lead to 2 different expressions of the condition. One is called heterozygous and the other is called homozygous. People who have the heterozygous condition, it's more common, and it's not as severe as the homozygous condition, but both of them are significant, and they both do cause early heart disease. It's just a question of how early and how severe.
When I was 5, my parents noticed that I had these things behind the backs of my knees and on my Achilles heels. And we didn't know what they were at the time. I know now that they were xanthomas. But because of that, those xanthomas and my dad's history and my grandfather's history, they took me and my sister, who's a year older, to have our cholesterol checked. And when I was 5, it was well above 800. So that was when we had confirmation for sure that I had inherited FH from my family. My father, who had the heart disease already, his was never as high as mine. So that was a sign to us, in addition to having these xanthomas, these physical manifestations in the skin, that mine was different even from my father's. We didn't have maybe a word for it, but we knew that it was worse, which at 5 was pretty scary to have already seen your father, have a chest scar and be in the hospital and things like that and be told yours is worse than his. So that was scary, I think, for everybody. My parents were open to trying whatever new medications came on the market for all of us to try to bring my cholesterol down, to try to move that time horizon out in any way that we could. So by the time I was 15, I had been on medication for 10 years. I was seeing a cardiologist regularly, and we knew that I needed aggressive treatment. So we were finding the best specialists that we could find.
HoFH patients, because of the severity of the cholesterol elevation, can develop heart disease or atherosclerosis early in life, first or the second decade. That means that they're often cared for by a team of practitioners or experts, a cardiologist, in many cases a cholesterol specialist we call a lipidologist.
So I was seeing the cardiologist probably 4 or 5 times a year and having labs done. And through the echoes, we started to see that I had been born with a bicuspid aortic valve, but I was also starting to show signs of severe aortic stenosis, which is a narrowing of the aorta in the aortic valve in the heart, and that can cause problems. One of the symptoms of that is sudden death, which is obviously a symptom you'd like to avoid.
Patients with homozygous familial hypercholesterolemia are also at significantly greater risk for a condition that affects one of the valves in the heart. It's called aortic stenosis. And they develop aortic stenosis because of increased calcification of the valve at a much earlier age than we would otherwise see it in patients who don't have familial hypercholesterolemia. We've seen an evolution on the development of pharmacologic interventions that can help patients and really alter the course of their disease.
I was on the maximum statins and other drugs that were available, and still my cholesterol was over 500. So we just weren't able to get into a reasonable range with medication alone.
There are still patients who may not be able to get their cholesterol down, and for that, we actually do a procedure that's called LDL apheresis. The blood is removed and passed through a filter, and the cholesterol is removed from the blood and it's returned back to the patient. And it can be done on top of standard medication, and it works very well to lower the cholesterol.
I started apheresis in 2001. I ended up doing it for 11 years. It was really the only thing that I was getting any sort of good results from. Starting around 27 years old or so, I was in that season of life when a lot of people were getting married. So I would go to weddings and I would dance at the reception and I would get out of breath and I would have to sit down. And it was a noticeable change for me. And then it became not just when you were dancing, but going up the stairs or taking a walk around the block that I would start to feel out of breath. And that worried me. I'd seen that in my father, and that scared me. The doctor said, it's time. It's time to replace the valve, and we're going to do a bypass at the same time. My whole life, I knew that my dad's first heart attack was at 28. And whether it was based in any sort of reality or not, I thought, if I can get past 28 without having a heart attack or having heart surgery, then maybe my future will be different from his. So I clung to that. Nobody told it to me. I just came up with it on my own. And then to go into a bypass and a valve replacement at 28 it was upsetting and it was disappointing. And I felt like, I haven't changed my future. This is still a part of what my future will be.
Welcome back. I'm meeting today with Kat Davis Ahmed, who is the Director of Outreach for the FH Foundation. Kat's journey with FH has been a personal one.
Thank you so much for spending some time with me, Kat.
Thanks, Erica, for having me.
So on the way over, we had a little chat, and you said something very interesting to me. As someone who lives with FH, who's had a family history of FH, what your normal is.
What's interesting for people with familial hypercholesterolemia is that because it's characterized by your high cholesterol levels and a family history, these are generally families like mine for whom there's just this long history of early heart attacks and premature death from heart disease. And so that's kind of expected. That's your normal. So for example, in my case, I inherited the FH gene from my father and a normal gene from my mother. And so I have the common form of FH known as heterozygous FH, about 1 in 250 people. So my cholesterol level is 2 or 3 times higher than what it should be. And I know that based on a simple cholesterol blood test of my LDL and my family history, which is in my family very clear. My father, his 3 brothers, myself, my 2 sisters. So for our family, the normal was that we were waiting for him to have a heart attack. It wasn't a question of if, but when. And what's kind of curious is that we accepted that. And I hear from a lot of families for whom that's normal, and they just take it as it comes and they expect it. But for me and my generation, and for my children's generation, and for all those other people with familial hypercholesterolemia out there, I think that isn't acceptable.
No, there is hope now. And so is this sort of what fuels your passion for the FH Foundation, because you are the director of outreach at the FH Foundation. So is that why you're there?
So I knew I had high cholesterol and that it was genetic. I didn't have the words for it, and I find that that's pretty common. So when I did Google it, I found the FH Foundation online, and I thought to myself, oh my goodness, it's a thing. It's not just something that affects my family, it affects other people, and I learned that it was, in fact, pretty common. So I was inspired and excited to find the website, and I volunteered immediately, and I was just so taken by the mission that I was doing more and more and started to work for the foundation.
Kat, how do we know if we have FH and if it runs in the family?
Well, all too often, unfortunately, a lot of people find out that they have FH after they have a heart attack or a bypass or stents. So FH can be diagnosed. Really just you need to know your cholesterol level, your LDL cholesterol level, with a simple blood test, and to understand your family history.
So if we're diagnosed with FH, what does that mean for our family, for our kids?
Whenever a person is diagnosed with FH, it's really important to communicate with the entire family, actually. Get your children screened, have their cholesterol checked. The American Academy of Pediatrics recommends universal cholesterol screening for all children between the ages of 9 and 11. Okay. And in part to find FH. So it affects only 1 in 250 people, but it's so important to find it. Right. And actually it stands out like a sore thumb if you find it in a child.
So Kat, how has FH affected your day-to-day?
The way that FH has affected my day-to-day is, I think, on 2 levels. One is that it's something that I do worry about on a daily basis, quite frankly. And there are times when I lie in bed at night and wonder if I'll wake up in the morning. But in terms of the practical day-to-day, and the thing that really helps me to feel more confident is that I do take medication for it, and I do know that it reduces my numbers, and I know that that medication will reduce my risk for a heart attack. The great news about FH is that it's treatable. There are several treatments out there available to us to help us manage those very high cholesterol levels and really slow the progression of heart disease and prevent heart disease and early death.
When I was 35, I went to the doctor for a routine checkup, and I had a heart attack in the doctor's office. I was without a heartbeat for 3 minutes. Fortunately, it happened while I was in a doctor's office, and when I woke up, I knew that something very bad had happened. So after my bypass and aortic valve replacement, I went through cardiac rehab. There were some bumps along the way, I think there always are, but within a couple of months, I was back to a pretty normal life. I have 5 nieces and nephews between my brother and sister, and 2 of them have FH. My son so far has been within the normal limits within his cholesterol, but that's something that we will continue to keep an eye on with him. And then our daughter, who is adopted, ironically, has been identified as having high cholesterol. So FH is common, and it's possible that hers is genetic as well. We don't know, but that will be something that we watch for her too.
Familial hypercholesterolemia is actually far more common than we often think. The less severe form, heterozygous familial hypercholesterolemia, is probably seen in 1 in 250 people globally. Homozygous familial hypercholesterolemia, probably about 1 in 300,000. Anywhere between 1 to 10% of these patients are being diagnosed right now in the United States. So that means 90% are probably not being told that they have a potential life-threatening condition that can be treated.
My cardiologist found a clinical trial for me to be a part of, And as a part of the participation in that trial, we did genetic testing just to confirm the FH diagnosis. And at 35 years old, to my surprise, the genetic results came back and showed that, in fact, I did not have heterozygous FH, but I had homozygous FH, meaning I had gotten it from both of my parents. And so all of a sudden, everything did make sense. I think it was shocking for everybody, not the least of which was my mother, because we always kind of had this coming from my dad in our minds. And so then you start looking and you go, well, my paternal grandfather did have a heart attack in his 50s, and my maternal grandmother had heart problems. And, my mother, her cholesterol has never really been particularly high, but she does have these painful bumps on her feet that are likely xanthomas. And so you do look at things from a different angle, and it makes you kind of realize, even when you felt like you were really on top of things, there are still things that we missed.
We don't find an individual with FH, we find a family.
Welcome back, everyone. I'm here with Kat, who's the Director of Outreach for the FH Foundation. We've now seen and we've heard what it's like to live with FH. So, Kat, let's talk more about the foundation and what are some of the resources that they provide.
So the FH Foundation is really there for patients and also for healthcare providers. We have a lot of resources on our website for patients and for healthcare providers to help educate them about the prevalence of FH, the genetics of FH, FH management. But another really important resource that we have is support for other people with FH. So we have a community online for people to talk to each other and get that peer support and ask questions of each other about what is it like to live with FH and what are people experiencing.
So it sounds like there's power in numbers.
There is. I think there's a lot of power in bringing people together who have FH so that they can learn from each other and then take that information, learn from our website and from other resources that we have, webinars, for example, and then be their own advocate when they go back and talk to their healthcare provider or talk to their family members. We also have this amazing project called the Cascade FH Registry. It's a national registry, the only registry of its kind in the United States for FH, that looks at the current experience for diagnosis and treatment for people with FH in the United States.
And what sort of information do we pull from the registry?
So what we're able to pull from that registry is, instead of just looking at, say, my story, my personal story, which is an example of one person or one family, through the registry we're able to put together all that information and generate data on what does FH look like in the United States today. And with that information we can help to improve diagnosis and improve treatment and help people understand on an individual basis how do they compare with others, help policymakers understand that there's really a need for better diagnosis and better treatment.
It's wonderful that the patients are both able to give and get information.
Yes.
It's wonderful. And we also spoke to Dr. Underberg about the importance of the registry from a clinical perspective, and this is what he had to say.
From the perspective of the healthcare provider, what's important to us is that by patients entering in their information, giving us information about when they were diagnosed, how they were diagnosed, what treatments they're on, and what sequelae they've had from the disorder, we learn more about the natural history of the disease. And as experts in the field, we can take that information and then we can tell people about it. And that alters the way we think about the condition.
There are a lot of new treatments available, and right now what I'm doing is combining the healthy lifestyle that I've always tried to live with 2 or 3 different drug protocols. I've actually been able to stop apheresis with some of the new generations of medications, so that's been great for me from a lifestyle point of view. And I'm very hopeful for the future. There's a lot in the works, and specifically for HoFH as well, that I think will be options for me and for the next generation in my family.
The exciting thing for me is that as we move forward, the management and care of patients with familial hypercholesterolemia keeps improving every day. And so that tells me that the outlook for the future is bright, not only for patients who have FH, but maybe for the children they haven't had yet.
Kat, thank you so much for joining us. Where can we find all the information we talked about today?
Thank you, Erica. You can find all the information we talked about today on our website, thefhfoundation.org, or also on Facebook and Twitter.
Fantastic. And I'd also like to thank Dr. Underberg and Allison for all of their insight. And of course, you can find all of the information we talked about today at our website, which is accesshealth.tv. See you next time.